What causes pelvic organ prolapse? I'm the Kegel Queen. I'm a registered nurse and my name is Alice Adams. And in this video, we'll talk about what causes pelvic organ prolapse. Why would those organs fall out of position? Let's talk about what it's like when everything is working well. Here we have the pelvis and the pelvic floor. Just part of the pelvic floor is here now. The inner layer is showing on this model at the moment. So normally we have our organs here, the bladder, uterus, and rectum, down in the pelvic bowl like this. And those organs are supported by the pelvic floor, this bowl of muscle here, and by ligaments from the sides and above. So the pelvic floor it's that kind of an angle like this, the pelvic floor from behind and below, ligaments from the sides and the top. And if you're missing good support from the pelvic floor or from the ligaments or both, that failure of support leads to the problem of prolapse, those organs falling out of place. Some of the things that can make you more likely to experience prolapse are childbearing, the physical stress of childbearing. If you are past menopause, the hormones that keep those ligaments, all that connective tissue, those ligaments, everything juicy and elastic, while you're in your childbearing years, there's much more elasticity there. After menopause, with the changes in your hormones, those connective tissues become more brittle. Then if you have had a hysterectomy, as so many women have, you lose an awful lot of the support for especially the bladder, but you're more at risk for prolapse of the remaining organs, especially the bladder, after a hysterectomy. True also with other pelvic surgery, including, ironically, prolapse repair surgery. Any pelvic surgery puts you at increased risk for pelvic organ prolapse, including the surgery that they use to repair prolapse. This is one of the many issues with pelvic surgery for prolapse, and one reason that you might not want to rush into that kind of surgery. Another couple of risk factors, one is smoking. And smoking has to do with two things. One is all that coughing that is part of being a smoker increases pressure against the organs from the inside of the body and can put you at greater risk. And also, smoking decreases the elasticity of the connective tissue. Those ligaments that support the organs become more brittle when you are consistently exposing your body to nicotine. Also, if you're overweight, this creates a kind of pressure against the organs that can make them more prone to prolapse. And then exercise incorrectly, certain kinds of physical exercise can contribute to pushing those organs, literally pushing them out of their proper place. To find out more about all of this, please visit kegelqueen.com. I'm the Kegel Queen, and I'm here to help.